Today, we're stepping into territory that is frequently visited in the bedroom but rarely discussed with the clinical honesty it deserves. I'm Dr. Narita, a urologist and pelvic surgeon, and after 12 years of clinical practice, I've seen that the difference between a deeply intimate experience and a medical emergency comes down to one thing: information. This isn't about judgment, it's about a sophisticated understanding of your body. We are going to dispel the myths and replace them with a medical roadmap for safety and sensation. To understand the risks, we first have to respect the biology. We often make the mistake of assuming all intimacy is created equal, but the anal canal is not the vagina. While the vaginal canal is a self-lubricating, elastic marvel designed for stretch, the anal canal is lined with incredibly delicate, friable tissue. It is designed for elimination, not penetration, and is governed by a powerful ring of muscle called the sphincter. When you understand that this tissue is thin and prone to microscopic tearing, you realize that your approach must be entirely different. It requires a transition from force to finesse. The first pillar of safe exploration is emotional safety. The biggest mistake isn't physical, it's the silent approach. True consent isn't just a one-time yes, it is a continuous, enthusiastic dialogue. If a partner feels even a hint of pressure, the body responds by tightening, which virtually guarantees a negative experience. You have to build an emotional architecture of trust through constant verbal and nonverbal check-ins. If the mind isn't relaxed, the body won't be either, and rushing this process is a violation of both dignity and physical safety. The second pillar is the lubrication mandate. Because the rectum does not produce its own moisture, going dry is more than uncomfortable, it is medically dangerous. Friction creates microscopic entry points for bacteria and viruses, making this the most efficient route for STI transmission. You need to use a generous, almost excessive amount of high-quality lubricant. Whether you choose water-based for ease or silicone for longevity, remember that lubrication is your primary shield for the fragile lining of the body. Third, we must address the pregnancy myth. Many people skip protection because there is no risk of conception, but from a urological perspective, this is a life-altering assumption. Because of the high rate of tissue tearing, the risk of transmitting HIV, HPV, and other infections is significantly higher here than in any other form of intercourse. Protection is an act of fundamental care. Furthermore, if you transition from anal to vaginal contact, you must change the condom immediately. Introducing anal bacteria into the vagina is a direct path to severe infection. If you are ready to explore, the strategy is simple: start small, stay slow, and always use tools designed with a flared base to ensure they don't get lost. Most important,